Hello, my name is Michaela Cox with Clay County Public Health Center, and I am a registered dental hygienist. Today we are going to talk about protecting your teeth. This oral health presentation is aimed for 2nd and 3rd graders. How do we protect our teeth? Well, we protect our teeth in 3 main ways. The first is home care, the second is visiting the dentist, and the third is mouth guards. We are going to talk about each of these today. Home care is the best way or the basic foundation of taking care of your teeth. Brushing, flossing, even mouthwash would be included in this. If we're not doing these things at home, we are setting ourselves up for a disaster. We need to make sure that we are brushing and flossing every single day. It's very important for the health of our mouth. Let's talk about brushing. You all know by now we need to be brushing 2 times a day for 2 minutes. Once in the morning, once at night. I want you to take a look at this first picture. Look at the gums, look at the teeth, and think to yourself, does this look pretty clean? Does it look good? Does it look okay? They could be doing better. Or does it look like, ooh, that's really, really bad? Well, this is okay. The reason why I say that is, yes, there is some plaque in there that we can see, maybe some yellowish staining of the teeth. The gums look all right. They're not super red and puffy. But what you really can't see is all the plaque that is hiding in the mouth. We can see some of it, but not all of it. This is actually someone that is probably around 3rd grade. So maybe even your age. And this is about what the average mouth looks like. So what this person did is they rinsed with a special mouthwash that stains the plaque in their mouth. So let's take a look at what their mouth looked like after they used that mouthwash. A lot more going on in there, huh? Looks a little bit worse. So, do you think this is going to come off with just a few swipes of your toothbrush? Think about how you brushed your teeth this morning, and honestly, the way that you brushed your teeth, would that get it off? Maybe for some of you, yes. Maybe for some of you, not so much. It's very important that we brush our teeth for 2 full minutes. We also need to make sure that we are brushing correctly. We want to point our toothbrush towards our gum line, as you can see in the bottom picture. Our gum line is the pink part that wraps around the white part of our tooth. We want to brush the outside surfaces of our teeth, the inside surfaces where our tongue can reach. We want to open wide, brush the teeth in the very back of the mouth. Those teeth have a lot of grooves in the chewing surfaces and can be an easy spot for cavities to form. We also want to brush our tongue, maybe even swipe the inside of our cheeks and the roof of our mouth. Brushing is a great way to prevent gum disease, cavities, and bad breath. Let's talk about flossing. Plaque's favorite place to hide is in between your teeth. So do you remember that picture that I showed you of the person that had rinsed with the mouthwash and then they had the purple staining of the plaque? Well, what they did is they went and brushed their teeth, and then they used the mouthwash one more time to see what was left over. So let's take a look. All right. So there's still, it looks better, but there's still some plaque that we see left in the mouth. I mainly see it along the gum line and in between the teeth. So this tells us that brushing alone cannot clean in between our teeth. We need to use floss at least once a day. Flossing will remove the plaque and clean the surface of our tooth and hopefully prevent cavities from forming there. Let's take a look at some other pictures. So if anyone's interested in working in dentistry when they get older, this x-ray is something that you will learn how to take. We use x-rays for a few different reasons, but one is so that we can see if there's any cavities forming in between the teeth. This first x-ray looks good. I'm not seeing any issues. I'm not seeing cavities. It's looking great. Let's take a look at an x-ray of someone who maybe wasn't flossing very much and was probably drinking a lot of sugary drinks like soda or eating sugary snacks. Can you spot the difference? Can you see the dark spots in between the teeth? Those are all cavities. A lot. I also like this next picture here. It shows the cavity in real life and on the x-ray. We can prevent this from happening if we just floss our teeth at least once a day. Just like brushing though, there is a correct way to floss, and we want to use the C-shaped flossing method. What you want to do to use this method is grab some string floss, pull out about 18 inches. Wrap the floss around your fingers using your pointer fingers to maneuver the floss back and forth. Gently wiggle the floss down in between your teeth. You want to go right under the gum line, as you can see in the top picture. Wrap the floss around your tooth and gently slide up and down. Do the same thing on the other side. When you're finished and ready to move on to the next tooth, make sure you get a new section of floss. That way, you're not removing the plaque from one spot and putting it right back in another. Also, don't forget to use mouthwash. This is a way that we can clean our mouth as like a bonus. The main thing I want you to focus on though is brushing and flossing. The next way that we protect our teeth is visiting the dentist. We want to go to the dentist 2 times a year for regular checkups. Now, a regular checkup is where maybe you get x-rays, you get your teeth cleaned, and you get your teeth checked by the dentist. Some other things that might happen when you go to the dentist is something called sealants. This is a way to protect your teeth from cavities. Sealants help to fill in those grooves so it's less likely that a cavity can form there. Do you see on the left picture how deep those grooves are on your teeth? Now these are teeth in the back of your mouth called molars. You actually get your first set of molars around age 6. You will have those teeth the rest of your life. So sealants are a great way to protect them from cavities. The way that a sealant is placed is it's kind of placed with a liquid form that becomes hard in just a few seconds, and it fills in those grooves, makes that area smoother so that it is easier to clean with your toothbrush. If it's easier to clean, then it's less likely that a cavity will form in that spot. Another way that we protect our teeth, and you may get this at the dentist or even when we come to your school and provide this, is fluoride. Fluoride is a mineral, but I like to explain it as a vitamin for your teeth, and it's found in water, soil, and rocks. It helps protect our teeth from cavities. It kind of puts a shield around our tooth. And our teeth absorb the fluoride through either tap water, toothpaste, or fluoride applications, like what we do at your school.